Hello, my name is Michaela Lowe, and I am majoring in exercise science and health. Health and healthy living has always been a passion of mine. Today, I will be discussing why exercise is vital to everyday life, statistics on obesity in America, and healthy alternatives to add exercise and physical activity to an already busy schedule. Did you know, according to the U.S. Department of Health and Human Services that was last accessed July 6, 2018, that only 1 in 3 adults participate in the recommended amount of physical activity each week. Although this number is low, exercise and physical activity are both very important to the mental and physical health of all ages. A common misconception is that exercise and physical activity are the same thing. The National Center for Biotechnology Information, in their article titled Physical Activity, Exercise, and Physical Fitness, Definitions and Distinctions for Health-Related Research, physical activity is defined as occupational, sports, conditioning, household, or other activities, whereas exercise is defined as planned, structured, and repetitive physical activity with a final objective of improvement. Though they are different, they are both vital to reducing health risks. For example, a common health risk is diabetes. Carl J. Kasperson, a researcher for the CDC, mentioned in his article, Aging Diabetes and the Public Health System in the United States, quote, that the incidence of diagnosed diabetes among Americans aged 65 to 79 years increased from 65% from 1997 to 2003, end quote. As you can see, if this rate continues, the projected number of diabetes in the year 2050 will be 55% of adults 65 and older. Diabetes is just one risk that people take by not eating right and not exercising. But if exercise has many benefits, why not participate? A separate group of researchers conducted a study of what exercise does to the brain in young adults. Their study, titled Aerobic Endurance Exercise Benefits Memory and Affecting Young Adults, concluded that physical activity can in fact improve visuospatial memory. Visuospatial memory is used every day when we visualize an address that someone is describing or when we are parking a car to determine the distance between the car and its surroundings. According to Harvard Medical School, another mental health improvement is that exercise and physical activity can both be used as an antidepressant. They published the Harvard Health Letter in September of 2008 explaining that exercise, quote, changes the brain in ways similar to antidepressant medications, end quote. Considering that exercise improves physical and mental health, why do more children and adults not participate? The U.S. Department of Health and Human Services website states that, quote, 28% of Americans, or 80.2 million people aged 6 or older, are physically inactive. I guess we cannot blame the children, but solely ourselves, because the department also stated back in January of 2017 that only 6 states, Illinois, Hawaii, Massachusetts, Mississippi, New York, and Vermont, are the only states that require a physical education class in all grades pre-K to 12th grade. We can conclude that the data received from the U.S. Department of Health and Human Services has also impacted the increased percentages of obesity of all ages. The department listed a statistic that stated that the percentage of obesity in children ages 2 to 5 has doubled, adolescents 6 to 11 quadrupled, and teenagers 12 to 19 tripled. After hearing those horrible statistics about children obesity, shouldn't we want to fix those numbers? Of course. However, I have good and bad news. Children and even adults cannot always help the way they eat or how they exercise or don't exercise. According to Dr. James A. Levine, who wrote the article Non-Exercise Activity Thermogenesis, there are several factors that affect our daily lifestyles. These include our family, the neighborhood we live in, cultural attitudes, historical circumstances, and genetics. Therefore, we do not always have total control over our circumstances. However, we can control how much we exercise or are physically active. The Harvard Health Letter stated easy swaps that we can make to control those insane statistics about obesity. Nutritional swaps include eating unsaturated fat instead of trans fat, and eating whole grains instead of refined carbohydrates. As far as adding exercise or being more physically active, walking to the second bus stop instead of the first is an easy change. If you have to park in a parking deck, park all the way at the top and walk down the stairs. Also, simply walking with good posture improves back and abdominal muscles. These are easy changes that can be done every day. In closing, I discussed why exercise and physical activity are both important. Second, we discussed the statistics of children and adolescents that do not exercise and are not physically active. Third, I listed a few alternatives to the things we do every day in order to add exercise and physical activity to our busy schedule. After informing you of the importance and benefits of exercise, I hope you will consider these healthy life alternatives to add to your everyday lifestyles.